What medicines are the best medicines for lowering cholesterol? Well, that's a great question because there's a lot of new information on cholesterol just coming out. First of all, we know that an elevated cholesterol relates to poor health, increased incidence of heart disease, strokes, and high blood pressure. We know that cholesterol gets in the blood vessels and can make the blood vessels narrowed where they don't give enough blood to the brain or to parts of the body, including the heart, or they can cause hardening of those arteries where our blood pressure goes up. We know all that. We know that the good cholesterol, the HDL, seems to be what we want more of, and it goes around and protects us by taking some cholesterol out of plaques. And the LDL, we know, the lousy cholesterol, is the part that gets into the blood vessels. So we want to lower the LDL, the lousy cholesterol. New information gives us more information on the LDL, the bad cholesterol. Now, normally we want the LDL less than 120 or 30. If you've had heart problems, we want it less than 100. Now, more and more we're saying we want it normally below 100, and if you've had heart problems or risk factors of heart disease, we want it less than 70. Newer information. When you look at the lousy cholesterol, the LDL, there's actually different sizes of the LDL molecule, large molecules and small molecules. And if you think about it, the LDL is what gets inside the vessels. The little small molecules are the ones that have the easiest time of getting inside the blood vessel and depositing and causing problems with cholesterol in our blood vessels. So we're going to be measuring the different sizes in the LDL cholesterol, and we're developing newer medicines that will help us decrease the small molecule, where we can have more large molecule. It's getting complicated, isn't it? We still want that HDL, we still want to lower the LDL, but now we can take the LDL and small particles. They're the ones that we want to even get lower. We're working on newer medicines that do that, and it looks like those newer medicines may raise the good cholesterol too. Meanwhile, we need to be watching what we eat, we need to be exercising, know what our cholesterol is, and follow our doctor's instructions.